don't do Botox, don't do filler, don't do threads before surgery, don't do Morpheus. It's wrong. I wholeheartedly disagree with that. All right, Ben Caughlin here, the greatest jawline ever. That's what I deliver, that's what you want. The greatest jawline ever, the greatest jawline ever. Repeat it, why? Because it's true. I want to talk about this article that's saying that these non-surgical treatments can affect surgical outcomes, that they're bad for surgery. Getting injectables now could complicate a facelift in the future or later. That title is made to fearmonger, right? They're trying to grab your attention like, oh my God, I got fillers, now I can't get a facelift. They go further into detail talking about which fillers do what. There's some biostimulating fillers. And then the phrase that they say here, sculpture-treated tissues are bumpy, bloody, and chaotic. I mean, that's so aggressive of a terminology. I'm going to explain why. I'm going to give a patient example. She says, I've had everything under the sun for 15 years prior to my facelift. Yes, I can tell if somebody's had threads. Yes, I can tell if somebody's had filler. Yes, I can tell if they've had Morpheus. But it does not make it more difficult. It changes the tissues. The layers are a little bit, approached a little more differently. I'll tell you, now it's the norm. It's more typical to see those kind of tissue changes than to see like a virgin face that's never had anything. Feel a little grittiness, like you feel the threads, but if you get the right instruments, it's fine, you know. So a little bit more of a fibrous layer, but overall a really nice dissection. Raising quite nicely. Right there, perfect, thank you, sir. So you can hear the grittiness. Probably they do a bunch of threads in this direction on her, I bet. Look at this is the reality. And I think they can be really aggressive back here with the IPL. Honestly, even like some good microneedling, yeah. And then whatever serums you got to add. I mean, oh, yeah. The case went perfect. She did spectacular, but it's a lot, right? We were talking about it. She did the facelift. She's now 5 or 6 months. 5 months. 5 months, and she's finally starting to be like, okay, the swelling's down, like almost gone.
I absolutely would say that the surgery part, like you said, is a lot. Even having been in the industry and being mentally prepared, not that I had any issues after the fact. It was like, whew.
Yeah,
it's why I did all the things I did to prevent getting the facelift as long as I have. Being in the industry, I've seen people heal from facelifts, and it's amazing how long the swelling does last.
Yeah.
And I think that sometimes surgeons minimize getting the non-surgical and going into the surgical right away. And I got to be honest, I'm glad I didn't do it at 48 because I may need another one. I don't want one.
Hopefully not.
Hopefully not, because I think.
Well, hopefully you need 6 more and you're 150 years old, actually. If you see, you can still see some of the scars. You can see little hyperpigmentation there coming back behind her ear. And it's still red back there when I push it with my finger. So look, that's still healing. She's 5 months post-op. So you just, I mean, this is done with the best of the hands in the world, and she's still healing. There was this Allure magazine, and they were talking about facelifts after non-surgical treatments. She's now had, I don't want to say every non-surgical treatment out there, but you've had a lot of them. Yeah, so she'd say, yeah. This is the key. Facelifts are great. I love them. I don't do them until people are begging for them, though, because it's a lot to go through. So then what are you going to do? Not do anything until you're, in your 50s? I mean, come on. I don't know any facelift I've done in the past 10 years that hasn't had these things, really, to be honest. Think about that. For me, at least, the large majority of my patients have all done it. I encourage them to do it. I encourage them to do it post-operatively to maintain the skin, to maintain the lift, to maintain the structure. So you got to do it before, you got to do it after, in my opinion. The goal would be to do it enough and never need a facelift. Listen, I don't want you to do it if you don't need it. I have enough people ask me to do it. So if you can maintain yourself enough, or at least delay it to your 60s, 70s, I think it'd be the ideal world, right? I hate doing lifts in 40-year-olds. Why? Because it only lasts 10 to 15 years, even in the best of hands. So they're going to need like 6 the rest of their life. During the surgery, I was like, man, this tissue's nice and tough. It's firm. some of that collagen tissue that we built with her threads and her Sculptra and Radiesse, all these other products, I was able to grab it and suture it a little tighter. So if you know what you're getting into, if you know how to approach it, if you can utilize what they've been building over the years, it really can become beneficial. It can be misleading to show intraoperative photos and to try to use those to push people into doing things one way or another. So you definitely don't want somebody to move straight to a facelift because they're scared of these non-surgical devices. A lot of these non-surgical treatments can be very safe and can be very effective if done properly.
Going back to going to really good providers, I traveled from New York to come to Chicago because I wanted a doctor that was okay with non-surgical procedures. I don't know how great I would feel going to a doctor that constantly puts them down, especially when most 30-year-olds today are having them done. So that this whole conversation is
doesn't make sense to me.
Scary. It's getting scary. It's like you're ultimately going to hurt your business if you don't do all the things.
Yeah, we have to.
Putting them down.
Well, we just have to. We've had to adapt to it. The surgeons involved in this said they weren't trying to start the argument, which is important. They were just giving this information out there for people because oftentimes people do say, is this going to make my surgery more difficult? Again, I still would stand by that. I don't think it makes it more difficult if we know what we're getting into. We have the proper tools and techniques to approach those. Given the abundance of conclusive evidence, I would argue with that because I'm not positive there is conclusive evidence on this. There are few black and white truths on this topic. Still, when asked which types of interventions tend to cause the biggest headaches during facelifts, most surgeons cite the same ones. Biostimulators, thread lifts, deep energy treatments, radiofrequency and ultrasound that purport to tighten or lift. Fat freezing, overly aggressive past surgery, including liposuction, are two others that come up frequently. So all of those can change the tissue. I think prior surgery, and to be honest, I think cystic acne scars are probably the most important and the most cumbersome. You know, unless we're revising our own surgery, we just don't know what layers they had gotten into. If it's my own surgery, it can make it easier in a way because I've already developed the plan and I know what I did. Now, a facelift is going to get people more outcomes. It's going to get people a much more of a change. Also done properly can be outstanding and done really well. There's some very good facelift surgeons involved in this discussion, and there's no doubt that that can be the right move. I love a facelift. It does a great outcome in people, but for many people, it can be inhibiting the scars, the downtime. You often still need some of these non-surgical treatments post-op. I think that's one thing that should be recognized. You know, a facelift doesn't make it so you don't need these things. You still want to upkeep your face. You want to upkeep your skin. It's like if you buy a brand new car, you change the oil every 6 months, you wash it, you still maintain it because it was expensive and you want it to look as good as it can for as long as you're able to make that happen.
I think we're doing a disservice if we're not talking about non-surgical to help maintain.
And the scars, you treat the scars with lasers. We just talked about she's going to start doing IPL now. Like, I mean, all this stuff, you want to keep it going. And the scars, you just got to own them. If you want a facelift, I tell everybody, and she heals well. She's got nice skin. She's taking care of her skin, so her scar discussion can be different. But some people, like, there's going to be a hyperpigmented scar that's visible. And if you look, you're going to be able to find these scars. Now, it's hard, you got to kind of know what you're looking for, but it's the reality. There's going to be a scar. We change the tissues. There's scars in multiple layers.
I think the expectations have to be there of realizing that when you have surgery, you have long-term, like you said, not complications, but nuances that we deal with.
I would even argue sometimes, if you know what you're getting into, two things. One, she had the stuff done by very well-trained people that know what they're doing. So with that caveat, because it probably did make it nice. I mean, I knew where the layers were going to be different. We utilized, the tissue was a little bit stronger. There was a little bit of that kind of collagen stimulation. There's this argument, oh, collagen stimulation is just scar tissue. Scar tissue has collagen in it, yes. You are but that's good. That's volume in the face. That's a good, strong tissue. So in this case, it was beneficial. I used to remodel houses with my old man when I was young. That's what I did. You know, I like working with my hands, rebuilding. And my favorite part was to take an old house, a house that was 100 years old, and we'd see all the changes that had been done on the house over the years, some of the scratches, some of the character you keep. But you can make it look really good, even if it had been remodeled multiple times before. Now, you approach that house differently than you would approach a house that had never been remodeled. It's different than you would approach a brand new house. This patient here, she told me, she says, I've had everything under the sun. I know for a fact she's had threads for like 15 years. I know for a fact she said Sculptra, Radiesse, Morpheus, fillers, Botox, neurotoxins of all sorts. And again, I knew that going in. She's going to people that know what they're doing. So of course, if you get these things done improperly, or if you get off the market, non-FDA approved materials injected, that's a whole different story. I'm not advocating that by any means. I don't think people should be scared of these non-surgical treatments. I think they should go to an injector who knows what they're doing. They should be open with their surgeon about what they've had done, but you want to find a surgeon you trust, and you want to be clear with your goals. That's probably my best advice. Prep your house for its next remodel. Keep up with the Botox, keep up with the fillers, keep up with the threads if you're happy with them, keep up with the lasers and tightening. Get it done well, get it done properly, and be clear with your surgeon. Find a surgeon you trust and be clear with your goals. I promise you it's not going to negatively affect anything. All right, cool. You stayed the whole video. Listen, like, subscribe, and you just get hotter from subscribing to my channel. That's the key. Hot is hot. Keep going. Like, subscribe, follow, whatever you got to do here. We'll see you around.